If you or a loved one has cancer but feel lost, and you don't understand the diagnosis, the treatment options, the side effects of treatment, or have other questions on your mind, then online oncology is the best place to find the right answers. Through a series of videos, we will help you every step of the way. Now let's get started with today's topic.
Welcome everybody to today's episode of Be Smart, Fight Strong. In today's episode, we're going to be talking about when to take second opinion for your cancer. Now, before I dive deep into the topic, I would like you to check my other video about what are the basic facts that you need to learn about your cancer. That information is very important for you to know about your cancer history. The short answer to this question, like when to take the second opinion, is that at any point during the care of your cancer, you can seek a second opinion. And you should always do that. I personally encourage my patients to get a second opinion. There are some situations which are really tough to manage, and it doesn't hurt to have an extra pair of eyes and ears to look at the case and give their recommendations. So let me discuss few scenarios when the second opinion is really going to benefit you. Number one, sometimes it's very hard to make a diagnosis. You get the biopsies, the pathologist reads them, your doctor gets the imaging studies like CT scan and MRIs, but still there is confusion on the part of diagnosis. And when that is the case, then it's a good idea to take a second opinion to confirm your diagnosis. Number two, if you want to know the exact plan of your care and the doctor is not clear as to what are the best options, and he is laying several options on the table for you, and you are confused as to which one to pick, I think that is a good time to seek a second opinion to confirm what is the best treatment plan for you. And if you have another doctor tell you a little bit more detail about the treatment plan and make it easier for you to make a decision, it's well worth it. The third reason to get a second opinion is just for the sake of mental satisfaction, for your own satisfaction and for your family members' satisfaction. Having a diagnosis of cancer is a very stressful time of life, both for the patient and for their family members, and mental satisfaction is very important at this time. You need to have a confidence in the treatment plan that you are about to start, because the treatments in cancer are very stressful, both physically, emotionally. They create a lot of stress, they are long, so they require a lot of perseverance. So you want your heart and mind to be 100% involved in that treatment plan. Therefore, before embarking on that tough journey, you want to have a complete peace of mind, and second opinions are highly encouraged in those situations. Number four, if you are under care of a doctor who practices in a situation where there are no clinical trials, but your best bet is to enroll in a clinical trial, then that will also be a good situation where a second opinion will really help you and increase the avenues where you can benefit the most from clinical trials. Number five, if you are dealing with a rare cancer. Now, a lot of physicians in the community are very good at managing the common cancers. They have a lot of experience. This is something they do every day. So they are very good at picking up the best treatment plans for their patients and to manage any side effects of the treatment that comes from those treatment plans. But if you are dealing with a rare type of cancer, then it is a very good idea to seek a second opinion and go to a higher center where they are seeing more of those cases. Because I may see a case once in 5 years, so I won't be able to serve that patient very well compared to a physician who is seeing 50 of those cases every year, because that is a large center with a huge referral base. So anytime your cancer is a rare type, you will benefit from seeking a second opinion. Number six, tough surgical situations. Surgery is a very important part of the cancer care. It can make a huge difference. Surgical skills for cancer patients are not present all over. Generally speaking, the bigger the center, the more surgical skills they will have to tackle the tough situations. A surgeon who is practicing in a small community and does not see patients on a regular basis cannot skillfully perform the surgery that your case may desire. Therefore, if you are looking at a very tough technical surgery, you are better off going to a center where they are doing those type of surgery in a larger volume. Now let's talk about what are the cons of getting a second opinion. And there are few. Number one, if you are diagnosed with a cancer, however, the cancer is a very fast-moving type and the treatment needs to be started right away, then you may not have the time to go for a second opinion and you may have to initiate the treatment right away. And this is actually a very common situation for certain type of cancer like blood cancers and lymphomas. Sometimes in other type of cancers too that come from our vital organs, that there is a sort of an emergent situation where time is of essence and the treatment need to be started right away. If you encounter any of those situations, unfortunately you will not have the time to seek a second opinion before you start your treatment. However, what you can do is start the treatment with the doctor that you went to, and then while the treatment is initiated, meanwhile you get the ball rolling on the second opinion and get it at a later time, and you can always change your treatment. The second downside of getting a second opinion is that sometimes the insurance might be out of network from a hospital or a doctor's practice where you really want to get your second opinion. And if your insurance is out of network, obviously they may not pay for that visit with the doctor. And in these situations, you have to make a decision. Either you pay out of pocket or get a plan that covers your doctor's visit and any other testing that the second doctor will perform on you. The third downside of seeking a second opinion is that sometimes it creates more confusion. Although your intention was to take a second opinion so that you get more clarity on your case and you have more clarity and confidence on the treatment that you're going to be doing for your cancer, but unfortunately a second opinion may create more confusion. So be mindful of that. Being said that, I highly encourage my patients for second opinions, because when they go to other centers which have more expertise, that is a learning opportunity for me too. And with that learning, I may help some other patients who cannot afford to go to seek second opinions. This is something you should never be hesitant to ask your doctor. You may encounter a situation where your treatment is standard across the board and all over the nation. Is just one way to treat that particular condition. And in these situations, you may not benefit from a second opinion. However, if your treatment is of rare type, then definitely a second opinion is well worth it. This is all I have today on the topic of when to seek second opinion. If you have any questions and concerns, then please feel free to leave a comment below in this video. You can also visit my website www.onlineoncology.com and also explore other videos that may help you during the course of your cancer journey. Thank you very much.
We hope you find this video helpful. The more knowledge you have and the more informed you are about your condition, the better decisions you can make about your health. Please spread the message to other people that may also benefit from this knowledge. We have covered several topics about cancer care in other videos. To learn more about these, visit our website, www.onlineoncology.com. You can also visit our Facebook page, YouTube channel, Instagram, and follow us on Twitter on onlineoncology.com. Be smart, fight strong.